almost half of all dementia cases worldwide may be preventable. Not 10%, not a quarter, almost half. And the part that should truly make you stop and think is that most people whose brains are already beginning to decline have absolutely no idea it is happening. The 2024 Lancet Commission report identified 14 modifiable risk factors that account for approximately 45% of dementia cases globally. 14. That means there are 14 opportunities where the story can unfold differently. Today, we are going to walk through them, what they are, how they affect the body, and what practical steps you can take to address each one. If you appreciate clear, honest health information without hype or fear-mongering, subscribe and leave a like. It helps this channel reach more people who need it. The goal here at Dr. Robert Ben is 200,000 subscribers, and every person who joins helps move us closer. You can also scan the QR code on screen to access the checklist for this video and other practical health resources. Let's begin with hearing loss, one of the most overlooked risk factors. Most people think of hearing loss as an inconvenience, something you adapt to and learn to live with. But research published in 2022 and 2023 tells a different story. Untreated hearing loss may increase dementia risk by 50% or more. That is a substantial increase from a single factor alone. The reason is surprisingly straightforward. The brain depends on stimulation. Neural pathways remain strong when signals continue traveling through them. When auditory input declines, the voices, conversations, music, and everyday sounds that keep the brain engaged, certain neural networks receive less stimulation, and the brain follows a simple rule. What is not used begins to weaken. There is another mechanism at work as well. As hearing becomes more difficult, many people gradually withdraw from conversations. Social gatherings become exhausting. Phone calls become frustrating. Communication becomes something to avoid. That social withdrawal often leads to isolation, which itself is a major independent risk factor for dementia. Clinicians see this pattern repeatedly. A person slowly disengages from social life, family members assume it is simply part of aging, and years pass before anyone recognizes that untreated hearing loss was one of the driving forces. A hearing aid is not a sign of getting old. It is a tool that helps preserve brain function. If you or someone close to you has noticed worsening hearing, it is worth discussing with an audiologist sooner rather than later. The same principle applies to vision. Your eyes provide roughly 80% of the sensory information your brain receives. When vision deteriorates, the brain experiences a similar reduction in stimulation. One statistic from the research is especially striking. Timely cataract surgery has been associated with a 29% reduction in dementia risk, nearly 1/3. That is not a minor effect. The Lancet Commission highlighted a meaningful connection between restoring visual input and supporting long-term cognitive health. Your eyes and your brain are not separate systems. They are deeply interconnected. Cataracts often develop gradually, which allows people to adapt to worsening vision and assume it is normal. It is not. Cataracts are treatable. Regular eye examinations and timely treatment are important conversations to have with your ophthalmologist. Now let's talk about sleep, because there is a myth I hear constantly. People often say, "I sleep poorly, but that's just part of getting older." No. Poor sleep is not a normal or inevitable consequence of aging. It is a problem that deserves attention at any age, and it turns out to be one of the most important factors affecting brain health. During sleep, particularly during deep sleep, the brain activates what researchers call the glymphatic system. Think of it as the brain's overnight cleaning crew. Its job is to remove metabolic waste products that accumulate throughout the day. Among those waste products are tau protein and amyloid protein, the same substances that form the plaques and tangles associated with Alzheimer's disease. Under a microscope, these abnormal accumulations are among the defining characteristics of Alzheimer's. The glymphatic system helps prevent that buildup, but it can only function properly when you are asleep. When sleep is shortened or disrupted, the cleanup process becomes less effective. Waste products remain behind, and over time, they accumulate. Research involving living human subjects, not just laboratory animals, has shown that even a single sleepless night can disrupt the normal metabolism of amyloid and tau proteins. One night. Now imagine what happens over years or even decades of poor sleep. When someone is diagnosed with Alzheimer's 20 years later, few people connect it to the sleep problems they experienced in midlife. Yet the relationship is increasingly supported by research. You already know how a bad night's sleep affects your thinking. The mental fog, slower reactions, difficulty concentrating, and increased irritability are not merely signs of fatigue. They are signs that your brain did not complete its normal restoration process. Then there is the issue of screens before bedtime. Blue light from phones, tablets, and computers affects a structure in the brain called the suprachiasmatic nucleus, the body's internal clock. This system regulates sleep and wakefulness. Blue light signals to the brain that it is daytime, which suppresses the release of melatonin, the hormone responsible for preparing the body for sleep. Reduced melatonin makes it harder to fall asleep naturally. At the same time, consuming stressful news, emotionally charged content, or endless social media feeds can activate the body's stress response. Cortisol levels rise, the sympathetic nervous system becomes more active, and instead of preparing for rest, the brain shifts into a state of heightened alertness. This contributes to what psychologists call rumination, a repetitive cycle of thoughts, worries, and mental rehearsals that continues long after the screen is turned off. Closing your eyes does not necessarily stop the cycle. So what actually helps? Research supports putting electronic devices away at least 45 to 60 minutes before bedtime. Progressive muscle relaxation, which involves slowly releasing tension from the body, one muscle group at a time from head to toe, has been shown to promote relaxation and improve sleep quality. Breathing techniques that emphasize a longer exhale can be remarkably effective as well. Try inhaling for 4 counts and exhaling for 8. That extended exhale activates the parasympathetic nervous system, the part of the nervous system responsible for rest, recovery, and calm. Start by relaxing the muscles of your face. Unclench your jaw. Release any tension in your cheeks. Let your tongue rest naturally instead of pressing against the roof of your mouth. As the tension leaves the face, the rest of the body often follows. Chronic insomnia, particularly when anxiety is involved, is treatable, and it is worth discussing with a physician or behavioral health specialist rather than simply accepting it as part of life. Now let's talk about muscle. This is one of the factors that surprises people most. Beginning around age 30 to 35, the body naturally starts losing muscle mass. After age 50, that process accelerates, with muscle declining by roughly 1 to 2% per year. By the age of 80, some individuals have lost as much as half of the muscle tissue they once had. Most people associate that with strength, mobility, or appearance. Very few connect it to brain health, but they should. Muscle is not just tissue that helps you move. It functions as an endocrine organ, producing and releasing signaling molecules known as myokines. These compounds influence brain function directly, support the growth of new neurons, and help regulate inflammation throughout the body. Less muscle means fewer myokines, reduced blood flow to the brain, and a higher level of chronic systemic inflammation. A study published in 2025 found that sarcopenia, the medical term for age-related muscle loss, is a direct contributor to cognitive decline, and that physical activity is the key factor influencing that relationship. In simple terms, muscle helps protect the brain, while muscle loss works against it. A sedentary lifestyle has been associated with approximately a 50% increase in dementia risk. The encouraging news is that you do not need a gym membership to benefit. 10 minutes of movement each morning, or even 2 brisk 30-minute walks per week, can significantly reduce the risk of cognitive decline, according to current research. The key is consistency. Regular moderate activity is generally more beneficial than occasional intense exercise. It does not require expensive equipment or a special location. It simply requires repetition over time. Balance is another early signal that many people misinterpret. A slight wobble while walking is often blamed on blood pressure, circulation, or aging itself. But balance depends heavily on the cerebellum and frontal lobes, areas of the brain that are also involved in planning, coordination, and higher cognitive function. These regions can show subtle changes long before more obvious symptoms appear. Research has consistently shown that declining balance and declining cognition often occur together. Here is a simple test. Stand near a wall or sturdy chair for safety. Lift 1 foot off the floor and try to hold that position for 10 seconds. Then switch sides. If maintaining balance for 10 seconds is difficult on either side, it may be a sign worth paying attention to. The vestibular system and cerebellum respond well to training, and simple balance exercises performed at home can lead to measurable improvements within a matter of weeks. Some of the most important changes, however, happen silently inside the body. One of those is visceral fat. This is not the fat you can easily pinch beneath the skin. It is the fat stored around internal organs, such as the liver, pancreas, and intestines. From the outside, a person may simply appear slightly overweight or carry extra weight around the midsection. But visceral fat behaves very differently from other forms of body fat. It actively releases inflammatory chemicals into the bloodstream, creating what researchers call chronic low-grade inflammation. This process is slow, silent, and often completely symptom-free. There is no fever, no obvious pain, and no immediate warning sign. Yet over time, it damages blood vessels, nerves, and brain cells. Visceral fat also contributes to insulin resistance, a condition in which the body's cells become less responsive to insulin. Most people think of insulin only in relation to blood sugar, but insulin also plays an important role in brain health. It helps protect neurons and supports communication between brain cells. When insulin resistance develops, the brain is affected as well. Some researchers have even referred to Alzheimer's disease as type 3 diabetes, because of the strong metabolic relationship between impaired glucose regulation and cognitive decline. The 2024 Lancet Commission also added elevated LDL cholesterol, often referred to as bad cholesterol, to the official list of dementia risk factors. That means monitoring your waistline and checking your cholesterol levels is not simply about appearance. It is an investment in what your brain may look like 20 years from now. Now let's discuss the warning signs, the subtle clues that may appear in yourself or in someone you care about. One of the earliest and most reliable indicators of cognitive change is speech. As neurodegeneration begins, language often becomes simpler before the individual even notices it. Words that once came effortlessly require longer pauses. Sentences become shorter. Complex expressions gradually disappear. Clinicians have documented a pattern in which a person's vocabulary slowly narrows over months or years, while the people around them adapt to the change without consciously recognizing it. If you notice that you or someone close to you is struggling to find words, stopping midway through sentences, or speaking in noticeably simpler language than before, It is worth discussing with a neurologist. Memory changes are another important sign, but the details matter. Walking into a room and forgetting why you entered is common and happens to nearly everyone. But repeatedly forgetting conversations from 5 minutes earlier, regularly losing track of familiar names, or confusing the order of recent events is different. These types of symptoms often fall into categories known as mild cognitive impairment or subjective cognitive decline. Neither is the same as dementia, but both represent a critical period during which intervention may be most effective. Another area that deserves attention is spatial navigation. Modern GPS technology has replaced one of the brain's most demanding cognitive tasks. The hippocampus, one of the first structures affected by Alzheimer's disease, plays a major role in navigation and spatial memory. When navigation is constantly outsourced to a smartphone, the hippocampus receives less stimulation. An easy way to challenge this system is to occasionally drive or walk to familiar destinations without GPS assistance. Navigate from memory. Give your brain the opportunity to do the work itself. This is not nostalgia. It is deliberate training for a part of the brain that you want to keep functioning well for as long as possible. If you would like a simple way to get an objective snapshot of your cognitive function, the SAGE test, the Self-Administered General Cognitive Examination, is a standardized screening tool that can be completed at home. It can help you determine whether it may be worthwhile to schedule a neurology evaluation or whether your results appear to fall within a normal range. It is a useful starting point, but it is not a substitute for a qualified specialist who can identify subtle changes that no self-assessment can fully capture. So what can you actually do to protect your brain? Not simply hope for the best, but take concrete action. First, move your body every day, even if it is only for 10 minutes. Physical activity stimulates neurogenesis, the formation of new brain cells. It improves blood flow to the brain, and the myokines released by active muscles directly support neural health. Brains in sedentary bodies tend to shrink faster over time. That is not a scare tactic. It is something researchers have repeatedly observed in neuroimaging studies. Protect your social connections as well. The Harvard study of adult development, one of the longest-running studies ever conducted, spanning nearly 8 decades, found that the quality of social relationships is one of the strongest predictors of both brain health and longevity. Not the number of people in your contacts list, but the depth, warmth, and consistency of meaningful human connection. People who maintain strong social relationships tend to preserve cognitive function significantly longer. Have real conversations, exchange ideas, attend cultural events. Stay engaged with the world around you. These activities are forms of mental exercise. Continue learning throughout life. Lower levels of education have been associated with approximately a 1.6-fold increase in dementia risk. But this is not really about degrees or diplomas. It is about whether you continue challenging your brain. The brain possesses neuroplasticity, the ability to form new neural connections in response to new experiences and information. Learning a language, studying a musical instrument, reading demanding books, all of these activities strengthen cognitive reserve. One study found that reading serious literary fiction for just 2 months produced measurable structural changes in the brain associated with improved cognitive function. Not passive scrolling, not surface-level content. Material that requires attention, interpretation, empathy, and critical thought. Read aloud whenever possible. It engages multiple brain regions simultaneously. Write by hand. Activities such as writing, drawing, crafting, or knitting stimulate large portions of the motor cortex. These are not merely hobbies, they are forms of neurological maintenance. Emotional health deserves equal attention. Depression is not a personality trait, a weakness, or a phase. It is a medical condition, and it has been associated with approximately a 2.2-fold increase in dementia risk. Researchers understand much of the mechanism behind this relationship. Depression increases inflammatory activity in both the body and brain, interferes with neurogenesis, and has been linked to measurable reductions in hippocampal volume. Cognitive decline and depression can reinforce one another, creating a cycle that affects both mental well-being and long-term brain health. Persistent sadness, loss of interest in activities you once enjoyed, chronic fatigue, sleep disturbances, and emotional withdrawal are all symptoms worth discussing with a healthcare professional. Depression is treatable, and early treatment may help protect the brain. Smoking and alcohol deserve serious attention as well. Smoking has been associated with approximately a 20% increase in dementia risk, while alcohol consumption is linked to an even greater increase. I want to pause on alcohol because one of the most persistent myths in health culture continues to circulate. Many people still believe that a nightly glass of red wine is beneficial for the heart, or that a small amount of alcohol before bed is somehow medicinal. Current evidence-based medicine does not support that belief. The scientific consensus has become increasingly clear. There is no completely safe level of alcohol consumption. Every amount carries some degree of risk. The question is simply how much and how quickly those effects accumulate. For the brain specifically, regular alcohol use contributes to brain tissue loss and disrupts the sleep architecture that the glymphatic system depends on to perform its nightly cleanup functions. That relaxing drink before bed may actually be working against the very systems your brain relies upon for long-term health. There is a well-documented case in clinical neurology that demonstrates how these risk factors often interact. A man in his late 50s, referred to in medical records as James, began experiencing mild difficulty finding words and occasional disorientation while driving familiar routes. He slept poorly, worked a sedentary desk job, consumed 2 glasses of wine every evening, and had untreated mild hearing loss. None of those factors seemed catastrophic on their own. Together, however, they had been quietly accumulating for years. His neurologist observed that addressing even 3 of those factors simultaneously resulted in measurable stabilization of cognitive function within 18 months. Not reversal, stabilization. And that is precisely the point. Early intervention can change the trajectory. Timing matters far more than most people realize. These risk factors do not carry equal weight throughout life. After age 40, many age-related brain changes begin accelerating. After age 50, dementia risk roughly doubles every 5 years. The earlier you begin addressing these factors, the greater the potential protective effect. Which brings me to a question that genuinely matters. How old are you? Age is not just a number in this discussion. It influences which risk factors deserve the most attention right now and helps determine where prevention efforts may have the greatest impact. So let's summarize what we covered today. According to current evidence, approximately 45% of dementia cases may be preventable. Have your hearing and vision evaluated regularly and act on what you discover. Do not delay treatment when treatment is available. Prioritize sleep. Keep phones and screens out of the bedroom. Maintain a consistent sleep schedule. Treat chronic insomnia rather than accepting it. Move every day. Even 10 minutes matters. Maintain a healthy weight. Monitor your waistline and have your cholesterol levels checked. Stay socially connected. Continue learning throughout life. Read challenging books. Take emotional health seriously. Depression is a medical condition that affects both quality of life and brain health. Stop smoking. Eliminate alcohol whenever possible. And if you have noticed changes in memory, speech, or navigation, consider taking the SAGE test and discussing the results with a neurologist. Earlier intervention is almost always better than waiting. If you found this information helpful, subscribe and leave a like. It helps Dr. Robert Ben continue reaching more people with practical, evidence-based health information. Share this video with someone who may benefit from hearing it. And if you would like additional health checklists and educational resources, join our community channels for ongoing updates between videos. As always, everything discussed here is intended for educational purposes only. Your health situation is unique, and any concerns about your cognitive health should be discussed directly with a qualified healthcare professional.